sleep disturbed breathing in children is the #1 thing to prevent them from having diabetes, hypertension, dementia, Alzheimer's, all of those disorders. Okay, who has the most highly functional brain that you know of? And he said, Asian females have the most highly functional brains of any person. And I was like, wow. He said, Kim, you have a highly functional Asian female brain.
So, Dr. Meyer, thank you so much for coming on the podcast. Dr. Meyer has been my dentist since I came from China, since I was a little baby. And your journey has expanded into this healing space, and I'm so excited to have you on today to talk about trauma, sleep, healing, the brain, and so much more. And what I like to start with is what defines your lifestyle?
My lifestyle as a single mother with 4 kids, as Carmiola would know, is very busy. It tends to be somewhat chaotic, but I think I show my children a good example because I'm a hard worker, and I tell them that they need to, anything worth having is worth working for.
I like that. That's amazing.
And they see me, and they just keep throwing more stuff on me, but it's all okay because they're all proud of me.
Yes, that's huge. And what would you say a point in your childhood that you can think back to really stands out as a turning point in your life and it made you who you are today?
That actually takes us down a rabbit hole of the transformational life coaching program that I just completed. So from 0 to 7 years of life, you actually have traumas that can happen that can arrest your development. So with me, I was born during a time of war. And in the first 4 years of life, my dad was taken multiple times for a year at a time because he enlisted in the Vietnam War. So in further deep diving that I've done, I read the book by Gabor Mate, The Myth of Normal. And I realized that we have these traumas that can affect us right from birth or prior to birth. He actually had his grandparents die in Auschwitz in Germany, and he was given away at 10 months old. So that made me reflect on my arrested development and why I feel the way I do. Because when we're happy, we're loving, and we're joyful as we're children, and then something bad happens, and we put a wall up. And that wall is a protection. And then after that layer is put on, something else bad happens. And during 0 to 7 years of age, we get our self-worth, our self-identity, and our self-love. And when those things happen, our layers become our prison. And not only did I lose my dad a couple times, but when he came back, he had PTSD from the war. And not seeing 2 of his children's all the first steps, it was kind of a challenge for him to be that father. And after that, I became a dentist because of an early event that happened when I was young, which ties in the airway, breathing, and sleep. When I was young, I was about 4, I fell and broke my nose.
Oh, wow.
So I could not breathe through my nose well. So I ground all the enamel off my teeth.
Oh, my goodness.
And I went down this journey not knowing the reasons why I was doing that. My mom didn't know. My mom was like, I have 4 daughters, no one has cavities. Every time Kim goes to the dentist, she has to have fillings replaced. And around 6 years old, I had a tooth removed with no Novocaine by a military dentist.
Oh,
and that put the fear into me of dentists. And I said I would never hurt another child again in my life. So I then, at that age, decided I wanted to be a doctor. I wanted to be a pediatric doctor for children. And I went through different struggles with going to school. I was always trying to feel worthy. Just like there's books out there by Jamie Lee McKern that is worthy. And like I said, those early moments in our life are what create our self-worth. And it's only through having 4 children and being a dentist that I've learned more and understand more about myself.
Thank you so much for going so deep into your past. And I think it shows extreme self-awareness and healing that you have done the past few years, the past lifetime, which I so commend and look up to. I feel like you have so much just self-worth work and inner child healing that you've done that I talk about a lot on this show. So thank you for sharing all of that. And it all makes sense looking back. And this workshop that you just completed and graduated from, did you do a lot of this trauma work and inner child work?
Oh yes, we had to do 6 hours of video journals,
Wow.
5-minute segments where we had to go right from the beginning all the way through a year. We had several in-person events where we had to go through exercises. There's one in particular, it's called the Earth Angel exercise, where you're sitting in the center and you have 3 people surrounding you. And you write on a piece of paper your limiting belief and what your new mantra is. And then you go through this process where you're closing your eyes and you have 3 people with their hands on you telling you what your new mantra is.
Wow.
You are amazing or worthy, and you are attracting abundance from everywhere. Different mantras that you go through. So there's a lot of breakdowns and breakthroughs. There was another exercise that was about a hurdle and what is keeping you back from breaking through and achieving your goals. And Lisa Nichols actually had to sit and work with me to figure out what my hurdle was. And one of my hurdles was actually cutting the cord with my children, because I've never been alone and I've always wanted to take care of them. I'm a nurturer and I'm a provider. And just the fear, I guess, of being alone, and what I didn't have, I wanted to provide for my children.
Right.
And then it's like, it's a give, but you need to allow them to make their own choices. They don't learn unless they go through this process. So
That's huge. And when in your career or your adult life did you really get into this space of wanting to heal and dive deeper into your past?
So I think going through a divorce and not realizing that when you have a relationship, 2/2 of people don't make a whole. You have to be a whole person to make that infinity sign or have the longevity of that relationship. And also with my children, I was first one in my family to go through a divorce. So it was a Catholic family, and you were told death do you part. And the trauma of that for my children, watching my children go through that, my divorce took a very long time, and we're at a good point now, we're more friends, but then that intrinsically, I saw my children mirror my image of myself, which then going through this process, even like with the sleep, I then went down the pathway because my children had migraines and they had sleep issues. And then I had my own sleep issues.
Right.
So I wanted to get to the bottom of that and get to the origin of the problem. So I got further learning. And then in the realm that I see now and treat TMJ patients and patients with sleep, some of my patients come to me, and being a dentist, you're in a very compromised zone. So you're close to the head, and people sit down and the first thing they say to you is, I hate going to the dentist. So not only the dentistry, but the trauma from not being able to breathe or sleep, I provide now a safe place. And a lot of these patients have anxiety, depression, and it's previous traumas that they've been exposed to that they can't heal. So now I went down the Lisa Nichols path I wasn't expecting to do as much change for myself, but I was expecting to be able to provide an avenue to help my patients and understand my patients more.
That's beautiful. And I just love how you've tied this all together in a beautiful story of your life. And I want to get now more into the sleep the
Yes.
technicalities of it. It's fundamental to our
Mm.
health. And I
Mhm.
know so many people who struggle with insomnia, sleep deprivation, anxiety, depression, like you said, in this technological world that we live in. There are so many outside factors. But what would you say is the biggest thing that you've helped your patients heal when it comes to their past trauma so that they're able to sleep and breathe correctly?
So I think with adults it's much different than children.
Okay.
So children, we can recognize sleep disturbed breathing early on, and we can then help them become healthy people. Okay, so that's where we have the greatest impact. Sleep disturbed breathing in children is the number one thing to prevent them from having diabetes, hypertension, dementia, Alzheimer's, all of those disorders. With adults, there's so many layers. It is very difficult. You have to have a team with sleep, with adults. You have to look at the structure. You have to look at, can they breathe? Or is it, there's multiple different parasomnias within adults.
Oh, okay.
So you also have PTSD. My father, for example, was in the military. He was in Vietnam. PTSD that was never healed. I knew and suspected he had sleep apnea. He then developed diabetes, and right now he's currently dealing with Parkinson's. So Parkinson's and dementia, we heal when we sleep. If we don't have proper sleep, we're not going to heal our body, we're not going to properly grow, and we're also not going to be able to deal with everything that's going on in our world, where we then become unhealthy. And also when you have stage deep REM sleep, you're connecting your memories, your short-term memory and your long-term memory. And if you don't get into REM sleep, oftentimes they're like, okay, sleep apnea?
Yeah.
I don't have sleep apnea. But if you've always slept horribly, you don't know if you're sleeping horribly. So there's both a physiological component, there's a mental and emotional component, there's a structural component, there's nutritional component. It's multi-layered. I have to work with ENTs, I have to work with oral surgeons, myofunctional therapists, PTs, OTs, osteopaths. It's a global type of issue that we have. But with children, you can actually start early on.
Right.
If baby boys are born premature, by more than 6 weeks, they already have sleep apnea.
Oh, wow.
If when a mother is pregnant by the 3rd trimester, she already has sleep disturbed breathing. Because think about that little baby in there. And I've only learned these things post having babies.
Right.
So I'm able to implement more things with my own grandchildren now.
It sounds like it's a lifestyle. It affects
Absolutely.
all of the aspects of your life, but then your sleep.
Right.
And like you said, when you're sleeping, you're healing your body, your mind, and your soul. And it's interesting what you said about the REM sleep and the dreams and things like that as well. And what are the specific things that you do for people so that they can heal this sleep apnea or these sleep issues that they deal with?
So with children, we can start early because children are like little, they're almost like clay.
Yes.
They're moldable. The roof of your mouth is the floor of your nose. So when babies are born, oftentimes they suck their thumb, okay?
Yes.
I learned from an orthodontist that also does a technique called the ALF, Advanced Light Wire Functional Appliance, that when a baby is sucking their thumb, they're actually releasing a cranial strain.
Oh.
So it's keeping them alive. And then all babies are born retrognathic with their jaw back. So when they suck their thumb, they're bringing their jaw further forward, opening the airway. So that's a huge component. But then it becomes a soothing thing.
Okay.
So it changes. But early interceptive airway development is one thing. But nutrition is huge. Environment is huge. And then the emotional traumas. Think of all the children that during COVID, okay, everybody was kept in the house, okay? We the speech and language pathologists had an increase of about 368% of children not speaking by the age of 3 because they couldn't see people's faces. They didn't have that interaction. They were kept away from people. And then you have people that, plus the fear of that, right? I mean, since COVID, I have seen a tripling increase in people coming to see me because of jaw pain and sleep issues.
Wow.
And the anxiety and depression is off the charts.
Skyrocketed.
It is. And what we put into our body heals our body. So if we're putting a bunch of crap in our body, sugar, gluten, dairy, we're going to get more inflammation in the nose. So we're not going to be able to breathe through the nose. In our environment, if you're allergic to a dog and you sleep next to a dog, guess what? You're not going to be able to breathe through your nose. When the tongue is low and you have a low tongue posture, every swallow stimulates the pituitary gland and the hypothalamus if the tongue is on the roof of the mouth. If it's not and the jaw is open and we're mouth breathing, we're not warming the air, we're not disinfecting the air, we're not moistening the air, and we're not mixing the air through our nose with nitric oxide, which is a vasodilator. So there's so many things because of dysfunction that can create underlying issues that affect our overall health and wellness.
Wow, that's a lot
I know.
of amazing information, and it all connects to also the brain, which you talk a lot about. And your license plate is Brain 02, which I love. And your car is beautiful. Love the Beamers. But you did a brain scan.
Yes.
Can you talk to us about that and the Asian woman thing?
Oh, yes, absolutely. So at the American Academy of Craniofacial Pain, we had a psychiatrist that I had already met in Hawaii when we had our TMJ Sleep Therapy International Annual Retreat. And he was doing brain scanning and transcutaneous magnetic stimulation. So what he will do is he'll put a scanner on the brain and it looks at your brain waves in every area of your brain. And I was interested to see what my brain was like. And so I asked him, I said, could I get this evaluation? And he said, sure. So when I sat down and he put all of these things on my head, I actually said, okay, who has the most highly functional brain that you know of? And he said, Asian females have the most highly functional brains of any person. And I was like, wow. So after he finished the brain scan, he looked at the brain scan and he said, I said, how did I check out? And he said, Kim, you have a highly functional Asian female brain. He said, but you also, I can see areas where you have PTSD and also you have sleep apnea. Now, I had taken a test years ago and I knew that I broke my nose. So this is where sometimes you don't put your own oxygen mask on, right? So I've been crazy busy going all different places. So I have a sleep study that I'm going to do on myself just to see. And orthodontically, you can expand the arches to create more space for the tongue and improve. And I do myofunctional therapy, but it's one of those things where you put yourself on the back burner oftentimes. But the interesting thing about the transcutaneous magnetic stimulation is it can help heal autism, it can help heal Parkinson's, it can be used for Alzheimer's, and especially PTSD. It can help with depression and anxiety, and it is a medical procedure that can be covered by medical insurance, usually after the age of 18, and it is amazing. So I'm looking at trying to get it in New Hampshire. I do believe I think we should even start with the veterans. Because think about the veterans. My dad's a veteran. My dad went a year with, I suspected a year and a half ago he had Parkinson's. It took him a year to get to a neurologist who said how broken our system was because he should have been diagnosed a year ago. He had Parkinsonian symptoms, but he wanted to wait for the VA. I had the ability to get him to another neurologist, but he's my father. He was just a kid when I was born. He was 20. So it was 2021. And he looks at me different than my sisters because we were both kids at that time, right?
Wow. That's amazing. The brain, sleeping, everything is so connected. And how would you help people in specific ways to then move forward once they know all of this information about their patterns, their lifestyle, what they need to change? How do you diagnose them? Type of
screening. There's
Okay.
three. My goal is to create a platform where people, no matter what color they are, what race they are, how much money they have the basic tools, a low-hanging platform where I can do podcasts like this, I can do webinars, I can do informational things. And we now have, I think, 72 centers in 8 countries. Some of the basic questions to look at: number one, do you fall asleep easy? Do you stay asleep? And do you wake well rested? Those are things. When you go to sleep, you should be sleeping in one position. You shouldn't flip and flop. Because if you flip and flop, you're usually flipping and flopping because you're suffocating all night long.
wow.
So those are just basic things. Looking at the environment and your nutrition, you have to look at all of these factors. The breathing through the nose, parafunction, grinding your teeth is not a normal thing. So grinding your teeth is often relative to an obstructed airway. And oftentimes we put a night guard in. But a night guard, if it's put in and you haven't done a diagnosis, it can make the sleep worse sometimes.
Oh, okay.
So there's, years ago I stopped making the flat plane spins as much without a diagnosis, so there's so much that we learn as we're going through this process. I mean, I think it was probably about 15 years ago when I started with my children that were having sleep issues and hyperactivity. So a sign of children that have sleep issues is hyperactivity, because children that don't sleep well are more hyperactive during the day. Often these children are put on medications.
Right.
And those medications, like Adderall, causes them to clench and grind their teeth more. So you should only touch your teeth 20 minutes a day.
Wow.
So there's so much low-hanging fruit. But the problem is even medical doctors aren't usually aware of this, and dentists. So I'm trying to create a platform where I can give general information to the general population, and children, Black children, Asian children, Latino children have more sleep apnea issues than white children. So there's different, anatomical features that create that. Trying to then create a platform for dentists to understand, and then to bridge medicine and dentistry. So I'm just one of these warriors, one of these gladiators, because our hygienists are the ones that see these patients more frequently.
Sure.
So giving them screening plans and devices. I just did a webinar on nitric oxide at the office. So we're going to be incorporating nitric oxide testing of the saliva to be able to see, are you producing enough nitric oxide? Because if you're not, you need to get it from your diet and nutrition, or you can take supplements. But they have to be good quality supplements. So there's so much.
That's amazing. And you yourself are creating a platform, like you said,
Yes.
to get all of this information out there. I think it's amazing, all of the invisible strings that you are tying together between, you said, dentistry, the medical world, and pediatrics, and all of the above, like what we were talking about. And you've been working with Rudy Meyer.
Yes.
And can you talk to us about how you are building your own platform to get this information out globally?
Yes. So I came across Rudy Meyer after working, having a coaching session with Les Brown, because I wanted to write a book. And Les Brown gave me a title for my book. It's still not written yet because I just had so many different things going on. Les Brown wanted me to look at my early growth and development, and my mother was my main strength, right? So Better Yourself, Creating a Life You're Proud of is the name of the book. But Rudy Meyer was a celebrity Les Brown was a celebrity for Rudy Meyer. And so I got to meet Rudy Meyer. And he said, Kim, with the advent of AI and marketing, you have to market yourself with that platform. Because if you don't, you're going to be a dinosaur. You're not going to survive. And I think with AI and the marketing through Rudy, we have a platform to get our message global. And we just went to an event, my friend Carmiola and I, at a castle to help me clarify my vision and my voice and to get that out there. And I actually wrote a chapter on organic marketing, because when I started, I just put a shingle up.
Right.
And I was pregnant. It was, I think, you were just born at the same time, because
Yes.
Lily, Grace, and my son are the same age. And I was pregnant. I had my baby. I opened my practice 2 weeks before my baby was born.
Wow.
He was born, I think, on a Friday. I went back on Monday, baby in tow, and he was around the dental office, his whole life.
Yes.
My 3 sons were, and my daughter was that little helper, cleaner, picker, upper. So, I mean, that being said, it was organic. I put a shingle up. I put my name on I did I think a press release to get that out there. Now what I'm doing is I'm trying to actually use the digital component of, for example, yesterday I had a patient that I completed treatment on, and I'm doing a video summary for her of what her issues were when she came in. She's 100% recovered.
Wow.
And what her posture looked like, what her nose looked like, what her breathing and her sleep looked like. And then I compared that to when we were finished with treatment. And then I also said, in the process, it took a little long because she got pregnant. And at the end of that, in the future, she might get pregnant again. So there are things that can happen throughout our life. Once you have a jaw-related issue or a pain-related issue, if you have a cold, if you have another baby, there's so many things. Menopause affects sleep so much. And there's so many women. I mean, why this is so important is because when we're not sleeping well, we're not healing. But if we're not getting oxygen to our tissues, we now have cancers. And cancers are on such a rise. Recently, I lost my brother-in-law to a brain tumor. My son's girlfriend's mother just died of a brain tumor. One of, I'm not even sure if you're aware of it, one of my daughter's best friends was just diagnosed with angiosarcoma at 32. He's only been married 2 years. So we need to take action.
Yeah.
The call to action is be aware.
Yeah.
Be aware of yourself. Be aware of your children. It's not funny to see a child snoring. It's not funny to see a child with an open mouth. Your mouth should be closed and sealed. Snoring's not normal. So these are things, and people wonder, well, why, snoring's fine. No, snoring's not okay. It's on the spectrum of sleep disordered breathing and dysfunctional breathing. So we need to take action to let more people know so they can intercept early so we don't end up in the hospital. We don't end up dying of cancer. We don't end up with diabetes. We don't end up with all the other medical issues that can come from that.
Right. And I think it's so amazing how your practice, as you were saying, has shifted throughout the years as you gain more and more information and awareness about all of these things. And what would you say is your vision for the next 5 years, the next 10 years? How are you going to take yourself to the whole next level? Because you're doing all of this amazing work with these mentors, and your book and the podcast and the TV show, which we can talk about. So what's your vision?
So my vision is, in the next 2 years, I really want to get my general dentistry doctors up to level and train them and all the new assistants. Through COVID, we lost a lot of people. We lost a lot of staff. So a lot of my staff was with me for 25 years, 24 to 25 years. And right now, it's new people, and they come in and they're like, why are you doing this? Why, what does this matter? And it is important. I'm looking at the whole body. I'm looking at the whole health. So I have 2 amazing young doctors that are with my practice. Another doctor that had retired and came out of retirement to work with me a couple days to help out with that. I have the TMJ Sleep Therapy Center. I'd like to have a nurse practitioner to work with me so that I can provide. The thing is we were told as dentists that we were not important. And we were not essential, which was really hard because people can die from having a dental infection.
Yeah.
So I had to see people during COVID that had cancers that if they had a tooth infection would kill them. Yet I was told I couldn't treat them. And I did it regardless because I was taught in dental school that anyone sitting in your chair could have a life-threatening illness that could kill you. So I was lucky to have 5 of my staff members that stayed and worked without being paid some days to get the office in a position where we could treat these patients and keep them alive. I didn't want to see a 90-year-old man go to the emergency room with a dental infection, get COVID, and die.
Yeah.
So I would have them. I have the advantage that I have 3 levels to my office. So my lower level is the TMJ Sleep Therapy Center. I also have gone off to facial aesthetics as well. But my goal in 5 years is to create a platform whereby the dental office is working independently, and I don't have to work as hard in that realm, to get a nurse practitioner, another doctor working with me with the TMJ Center, and then build out an integrated wellness center on the property next to me with the doctors I need, maybe orthodontists, chiropractors, body workers, possibly ENT, pulmonologists, a naturopath, people that can look at the whole person. I have a dream of actually incorporating it within a college where that we can all teach our doctors from the first level. And University of New England is a really good college because they have physical therapists, OTs, dentists, medical doctors. Everybody's in that school. So why not start a program whereby they can all learn together? You put this patient in front of you and say, okay, what do you see? And it has to start earlier. All trying to sit down and come up with a screening plan for children, for physicians, dentists, and even maybe put it in the school systems.
That would be amazing.
And also into the daycare setting.
Yes.
Because daycare providers are going to see these kids and they're going to recognize them. And if we can have different platforms where we can intercept early, we can have a greater impact. So that's kind of where I want to go with it. I know it's broad and maybe it's too broad, but I'm a good connector. I can connect people, and I've been able to help so many people doing that. And then I would like to have this integrated wellness center next to my office also bring in these top level speakers.
Right.
And doctors. Education is so important.
Yeah.
And then maybe implementing that with the dental schools too, and the medical schools, like I said. I mean,
bringing it all together, marrying all of the knowledge that you have is amazing, because it does need to start from the source, from the ground up, and from our education system, so that these doctors go into these practices and have this holistic knowledge.
Right.
I think that's amazing, because I feel like in a lot of industries, even the industry that I'm in, everything's so siloed. Information is just so siloed, and it takes such effort and more work to get beyond your industry or beyond your profession to then try to cross over. So it's like, how can AI and how can people like us connect people in this realm of knowledge to really connect and create beautiful solutions?
Oh, absolutely. And I mean, some other cultures for years have known connections.
Right.
Look at Chinese medicine.
Yes.
I mean, you have the tooth organ chart that you can look at a tongue and know, but a lot of people were like, oh, that's not real. I mean, come on. These are things, when someone has a coated tongue, that scallop that has deep fissures, they're not healthy.
Yeah.
That's not the healthy appearance of a mouth.
Right.
And there's 4 pathogenic type of bacteria that cause leaky mouth, leaky brain, leaky gut, leaky heart. So the mouth is so important, and it is the window to our health.
Yeah.
So just looking at that, and we are important, to be able to do that and help and heal patients. It's amazing.
It's huge. Yeah. And overall, macro-wise, would you say as a society in general, we've gotten to this point of tragedy, almost, of like health, mental health, post-COVID? It's just been really tough for people, physically, mentally, spiritually, emotionally, that we are looking backwards. like you said, to the ancient Chinese medicine, and we're kind of going back to the holistic approach. Would you say we're kind of at this turning point?
I think we are. I think there's going to be more spirituality.
Yes.
The breathing, the meditation, just keeping it simple.
Yeah.
You know, laughing, communicating. You don't need a degree to talk to someone,
Right.
and make them feel good. I mean, after I just finished this this program, I don't even know what my next step was.
Yeah.
Where was I going next? And I had 3 people reach out that know me and were like, "I'm going through a divorce. I just sold my practice. Can you coach me?"
Yes.
And I was like, "Well, I haven't really started my platform for that yet, but why don't you let me just do it pro bono,
Right.
so that we can work through this together
As humans.
You know, as humans. I mean, and I think I heard a neurologist or psychiatrist that was talking about it, and she actually said, you don't really have to have a degree to be able to be the human, to see, hear, and value a person. And sometimes that's all they need.
Yeah.
They need to just have someone that looks them in the eyes and talks to them and puts their hand on their hand and says, it's okay. You are safe. You know, you're in a good environment. And that's what Lisa teaches too. I am safe, I am protected, and I am loved. I mean, we have so many things that go through our brain that are incorrect.
Right.
So
retelling ourselves
Yes.
our story.
Absolutely.
I've been looking into and reading the book The Power of Now.
Yes.
After going through a couple rough months, it's just like coming back to your center and yourself, whether that be spiritual or just meditative. It's huge. And what are some things that you do for yourself when it comes to self-love on a daily basis?
Yes, so I love the ocean and the sunrises.
Yes.
I love gratitude. I try to look at what I'm grateful for every day. I typically, I mean, it's been a little crazy since I've had a house guest, but typically I get up first thing in the morning and I light a candle, I put on some incense, I have coffee that's brewing, and then I'll have that, and then I'll go work out in the infrared hot sauna, hot works.
I love that.
And then I come back and shower, and I've already gotten and I've done some house things, you know, changing over the laundry, doing the dishes, that kind of stuff, let the dogs out, help with that. And then I go home. Journaling is huge too, writing things down, and just what I need to do more of is just being, you know, just slowing down, resting, and being.
Yes.
And there's only so much we can control.
Totally.
I mean, oftentimes we're either depressed or anxious because of what's happened or the fear of what's going to happen.
Right.
And we lose what's happening right now.
Yes.
So, for example, even with this this graduation, I was celebrating just being in the moment and connecting. Even though I had done that course before, I basically wanted to meet new people. I wanted to celebrate new people. I wanted to just be me. And I'm pretty much a pretty joyful person.
Yes.
And even through COVID, when we were not allowed to go to the ocean on the beach, I would go down and take pictures, and I would post a saying, and then I would put it out there. One of my employees, her husband, for two different tours of duty, was away for a year. And I used to post motivational things in the morning on Facebook, and he actually came back and he awarded me with a flag that he took to every post, and he said, do you know, I used to share your positive posts with the soldiers, and it made such a positive impact. So we don't know the ripple effect of what we do, right? I mean, I would try and post things during COVID to just be positive, and not everybody has the ability to see a sunrise over an ocean, you know? And people would say, oh, keep posting, Kim, keep posting. And then if I didn't post it, everybody's like, are you okay? Is everything okay? But even my son, Derek, this morning said, Mom, I just want to let you know that I saw your inspirational post on Facebook. That's really nice. It makes me really happy.
That's so sweet.
So, and he's a father now, so he gets it.
Yeah.
So,
oh, that's huge. You are just a ray of sunshine.
oh, thank you.
And I so appreciate you coming here to record this podcast. I feel like we could do a whole series.
Oh, yeah.
We'll be back many more
thank
times.
you, thank you.
I just find all of this so fascinating, and going through my own healing journey and being very in touch with my mind, my body, and my soul. I feel like we aligned.
Oh,
And I
yeah.
just love that you have gotten yourself into this whole new realm.
Oh,
and
yeah.
you're bringing it global around the
Trying.
world. And I'm glad this is a launching point for you.
Yes.
So how can people work with you, connect with you, speak to you?
So Carmiola's been helping me set up different platforms. I'm trying to figure out the whole Instagram.
I'll help you with that.
Okay, so you're gonna help
do
me
that
get
together.
that. You'll help me get that out.
Yes.
I am a TMJ Sleep Therapy Center International, so we have different platforms for that. And as the president-elect of the AACP, we're working on how can we do local study clubs.
Okay.
And actually, one of my employees, Amanda, used to be Perrin, she went to school with you as well.
Oh, okay.
And she just had an idea. She's like, Dr. Meyer, we really need to start January with going into the libraries and the schools.
Yes.
Because kids coming back from Christmas
Yes.
are so overwhelmed, hyperactive, all of this. But if we just did something about the breathing, we could do that. So I'm trying to get out to the local areas, but also I have the Healing Humanity One Breath at a Time platform, but Rudy is, I think, helping me to titrate things down so that I have a platform where people can go to so that they can get online training and then maybe in-person training, coaching, that kind of thing. So it's a work in progress, but I'm hoping that I'm able to do these things by early next year.
Exciting. I'm so grateful for you, your time, your knowledge, your expertise, and our friendship that we built over time and have stayed in touch since I was brought to the U.S. So it's been an amazing experience. And thank you so much, Dr. Meyer.
Thank you.
This was so fun. Hi everyone. On this next section of the podcast, we are going behind the scenes and talking to Carmiola and Dr. Meyer to see their backstory and how they met and how their expertise and soul sisterhood has really transformed their lives. So on this segment, I hope you enjoy a little bit of the explanation of who Carmiola is, and her podcast will be coming out in the next few weeks. So stay tuned for that.
My name is Carmiola de Santura. I met with Kim at the Lisa Nichols event, Try to Inspire, in 2023, and we clicked immediately. And we knew that our souls need to know each other in order to elevate and help each other. And since that time, I think that we are soul sisters for sure. And I think that we need each other into each other's lives in order to never forget who we are.
And I'm Dr. Kimberly Meyer, and I'm a dentist and a mother and a woman. And I went to Thrive to Inspire to try and find me and what my future self would be. And on the first day, just like all the time, I was just getting there. I was late. I was rushing in. And I met another friend of ours, Tangela Huggins, and sat next to her. And then Carmiola, we just connected. Carmiola and also another friend of ours, Renee. And we just knew that we were going to be together. And it's just like one of those things it's like, did we know this person before in a different life? It was a soul connection, as Carmiola said. And we, at that point, decided we didn't know how, but we were going to do the Lisa Nichols Certified Transformational Trainer Program with Lisa Nichols. And it has been a journey. We have been there to uplift each other. At times when we said, how are we going to possibly get all this done while we're raising families, while we're all over the place, and having to run businesses and go back to school. It was 1 year of intense training. And for me, the challenging part was being on video and seeing myself and hearing myself. Carmiola is very experienced in that, so that wasn't her issue. But
My issue was being not American, being not here. The challenge for me was to come here like 4 times in a year from Estonia, from Europe. You can only imagine 10 10 hours flight. Last time when we had to fly to New Mexico, it took me 38 hours to get to New Mexico. That was crazy. That was crazy. I was sleeping in airport, and that was crazy, but I got there and I gave my part. So it has been challenging for sure, but the challenging, if you face the challenge, you face all the gifts. So you have to cross the bridge in order to get the gifts. So the bridge was for me to get from Estonia to America, and that's the thing. Yeah.
And if you can imagine having that language barrier. I mean, she teases with me and says, I'm her mother. I'm her big sister, not her mother. But together we elevate each other. And when it's like, oh my God, I can't do this. Like, she comes across so confident. And we were at Rudy Maller's castle event, and I saw me reflected in her. Because the first day she's like, what do I do? Oh my God, I don't know what to do. And then it was a total transformation overnight, because she was like, oh no, I'm not going to speak. I'm not going to speak. I said, you are going to speak, and you are going to take the stage. And so she was so intense, going home, learning it, and coming up with her speech, and she won. And then she goes, okay, what's next? What's next? And I said, we're going to Lisa Nichols. Talk to Charcy. See, and she goes, you really think so? I said, yes, go, take action. So she texted Charcy. She said...
Charcy was the Lisa Nichols, like a stage manager.
And she said, Charcy, I would like 5 minutes on the stage. I just won a speaking competition. And Charcy didn't answer. And she kept saying, oh my God. Well,
the unknowingness.
Yeah, the uncertainty.
Yeah.
It was like crazy.
It was crazy.
She couldn't focus.
Yeah.
And even getting there, it's like Lisa Nichols is doing a Broadway show. So she was practicing. We had to practice our graduation. It was delayed. We hadn't heard from Charcy. Then we see Michelle. Michelle said, yep, you're on the docket here. You're going to be doing this thing. And she's like, what do I do? I'm going to be up there. She didn't know until the last minute. And I said, you just be you. You just be you. And that's what they teach you. When you get on the stage, it's better to go right from your heart, not from a teleprompter, not from something like that, because that's not real. You don't have the emotion. You don't have the feeling. And she got up there, and oh my goodness, she claimed her spot, and she made it happen.
Yeah, exactly. Yeah. So this I've been here from the 14th of October, and today is already 22nd of November. I've been here every day. We wake up. What's next? What's the challenge? What's the adventure? So that every day we wake up in a new adventure. Even being sick. Last 3 days has been an adventure, because you know that your body has been switching off from all the tension.
She was exhausted.
Yeah, from all the adrenaline and the
adrenaline.
Yeah, adrenaline and everything. And what's fun part is that for everybody who listens to that, and everybody who has the doubt in them, that my biggest challenge 2 years ago was to speak in English in front of audience. That was my biggest challenge. I came to America to learn with Lisa how to go through this hurdle. My hurdle was to speak in English. And today, in this 2 months period, I've been on big stages twice, winning the competition and being on Lisa Nichols stage, speaking in English. Like, you can do anything if you have the goal. You have to catch it, and then ask, what's next? What's next? What's next? And I feel my voice is going, like, I feel like my voice is tired already again.
Well, it's tired, but there's the excitement, and
yeah.
I mean, you know what's next.
Yeah.
We have an event tomorrow. She's got to get home, she's got to hydrate, she's got to be in the right space, we've got to set it all up, and then we have a vision boarding planning for next year. What are we going to do next year? We already know she is starting an online, virtual 6-week program from Estonia in English, And then she's doing a TED Talk in Atlanta.
In April.
And then we are both in a TV streaming series with Rudy Mauer called Legacy Makers. And
So we are legacy makers.
We are! Woo!
Jesus. Yeah. And when she said about that, I'm not your mother, I'm your bigger sister, I want to say something about that. Our mothers have unconditional love. Our sisters may have something behind, they may have the neediness, they may have, something there which is not unconditional, but mother love is unconditional. And I feel like when Kim's is with me, I feel like this love that is unconditional, like she would give her soul in order to help you. So that's
Thank you. That means more to me than you know.
Yeah.
That's awesome. I know I oftentimes have people, my patients and other people say, can you adopt me? I want to be your baby. But I hear that often. But when she was calling me her mother, I'm like, I'm not that much older than you. I can't be your mother. You're my baby sister. But I get the perspective of unconditional love. And that's one of the things that in this program with Lisa Nichols, we learned how to have no judgment, provide a safe space, no repercussions, and unconditional love, which we don't have enough of that in this world.
Yeah.
And that's why we have a bigger purpose.
Yeah.
And a bigger vision.
To be an example, to inspire, and to help people to thrive.
Yeah, to be that light in the storm.
Yeah.
And we have
Light
a whole new beginning. There's so many new things happening. And we thank Lily Grace for
And now we've met Lily.
Yeah.
And what a wonderful name, Lily Grace.
I know, isn't it? It's beautiful.
It? Yeah.
So my grandmother's older sister's name was Grace, Auntie Grace. I lived with her for 2 years, and I wanted to use the name Grace for my daughter. And my sister, whose name is Andrea Grace, wanted to use that for her daughter. So I decided to ask my aunt, what's your middle name? And it's Sarah. So I named Nicole Sarah. And then my aunt, whose name was Grace Sarah, was like, why would you ever do that? I hate my middle name. And I was like, because it's special to me and I couldn't take Grace. I had to take Sarah.
Yeah, it's a Grace, it's a holy, it's a beautiful name.
Yes.
Holy name. Why
It
is it
is
holy
a
name?
holy
Yes,
name.
because it's a holy name, yeah.
It is.
Holy Grace, yeah, yeah.
But can you imagine having to train your brain to think and speak in English when you're from Estonia? On a regular basis, she's telling me in Estonian. She forgets that I don't understand. She's tried to teach me a few times. It doesn't stay.
Yeah, and your brain is getting tired, and that's why I admire people who are their native language is not English, and they're struggling and they're talking. They're struggling and they're talking, and I hear people like how the dictionary is working up here. Like they're selecting the words because they have to skip some words in order to replace them with words they know, and then they choosing these words. If I would speak in Estonian, I would say maybe in another way, but I have to choose from the dictionary, like what words I know from this. Like you have to play with words, but I'm getting better and better and better. So people who stop themselves from speaking out because they don't know English, I would say, start talking. Even in front of the mirror, just start talk your subject. Get so good that you don't. For example, what got to me here today was that I had to prepare the talks. I had to learn some talks. So that gives me the confidence and certainty about what I want to say. So you don't stumble behind the words because you've learned and you provide. And that's what people should do. Do even if you're afraid. Do it.
And we receive that because I can't imagine. I have a hard time stumbling over the English words and I only know one language. So to have to translate it, and I've had many friends that are from other countries. I don't know why I attract the world to me.
Yeah.
And I ask them, when you've been in the United States for so long, do you think and dream in your native language or in English? And a lot of them that have been here are in their English. And then when they go around where they're from, then they're back to their regular language. It's interesting. I mean, the dynamics of the brain, as we were talking about, it's amazing.
Do you know what's interesting? Maybe because some listeners are just getting in like aha moments. The thing is that when you're going to abroad, for example, if you're going to Ireland, you pick up the language, the dialect over there, or in Scotland. You start. When I lived in Ireland for a year and a half, I started to speak in Irish dialect. And when I came to America, it was like people said that, "Are you from Ireland?" No, but I know, and when you go even when I go to Atlanta, for example, there is a different dialect. The dialect is different, so you pick up the dialect. You pick up the even if for example I go to Italy or I go to some other countries, I start to speak with their the way they speak English. I mirror them. So it's good to be in the environment where you mirror people so that you learn quicker. Yeah. Okay.
Yeah, and it's been also a stressful time for her. Can you imagine being a mother to 2 boys and leaving for a month and a half? And we went up to my camp in the mountains, and we went for peace to kind of be away from my children. And all of a sudden I get a text about something hitting Estonian building. And here is Carmiola that now has this text, and she comes over all happy. We're getting nice, happy, organic food. And she said, "Is everything good?" And I'm like, "No, it's not good. Let's look." And then, then the hardness of the difficulty of trying to get in touch with her family with no Wi-Fi.
The message, the importance here is, what was the message? You have 2 sons in Estonia. You know the situation before the elections in Estonia, where the NATO and everybody is ready. My son, who is 16, they're preparing the boys for getting ready for in case there's gonna be a war. So you're in kind of like in a mood where you're always ready to be ready. And suddenly Kim shows the message that says Russians attacked Estonia. It wasn't that something happened, it was Russians attacked Estonia. And suddenly in this 2 seconds period when nobody says yet anything, your brain doesn't absorb what you just learned. I died in this moment maybe 10 times because this story in my head was so intense that I couldn't even absorb the information anymore, because you suddenly died like 1,000,000 times, because you were at home thinking, where's my son, where's my husband, where's my parents, I'm here, how can I teleport myself there, how can I help, I cannot get in touch with my family because I didn't have the Wi-Fi, yeah? And so you're in the middle of nowhere suddenly, and I felt like so helpless, and that was the reality in these seconds. But very soon we figured it out that it was Estonian embassy house that was attacked by Russian drones, but still
in Ukraine,
but still this being in this moment was something that I will never forget.
No.
And now I understand when they're saying that if you haven't been in a situation, you don't know what the situation is. I understand people who are in the war, their nation is in the war. I understand them now, what it means that your house has been bombed or whatever, because I felt this pain in every cell of my body, where you cannot do anything and you know something is happening. So I don't know why we came here. Yeah, just the experience.
We were just talking about the experience.
Just the experience.
I mean, the intensity of being away from your family for so long, the uncertainty of what was happening. She came before the election. And so that was pretty amazing, because she actually got to be here for the election. And all my kids went and voted, and we waited in line, and she was interviewing everybody for the election. It was crazy. And it was her first experience. So her mind has been blown since she's been here.
Yeah, it
and
has been.
she asked, and she received. And every single day we've had something.
Yeah.
And
Adventure.
an adventure. And it's not going to end. It's just going to be different and better next year.
Yeah.
And we're bringing Lily Grace along with us.
Yeah, and then we ask, what's next?
Yes, what's next?
Yeah.
Claim your spot.
Claim your spot, what's next? Ask what's next, and then claim your spot.
Yes.
Thank you, ladies.